Welcome back. Let's now get you updates with regards to the residents' welfare associations that have really stepped up now to take more responsibility in major cities like Delhi and Bengaluru. To begin with, let's talk about these two centers. In Delhi, RWAs have prepared their own COVID centers to tackle emergencies. Meanwhile, in Bengaluru, RWAs have turned into COVID watchdogs to keep a check on the violations in their societies. To talk about both these cities, I have with me Alok Singh in Delhi and Neha Srijay, I beg your pardon, joining me in Bengaluru. So coming to you first, Alok, in Delhi, it seems in the national capital, the resident welfare associations have even gone to the extent of now organizing for oxygen cylinders in order to create COVID beds within the society premises. Tell us what exactly is the role and responsibility that the RWAs have started taking up now.
Well, Afrida, good morning to you. And as far as the Delhi is concerned, the number of cases are increasing daily. In fact, yesterday, 2,200 cases, more than 2,200 cases came to light, and these were the COVID cases. And this is the reason that the beds, the demand of the beds have also been increased. Now, the societies, the various resident welfare societies are now geared up, and they are now setting up the beds in their society. In fact, they are taking the oxygen cylinders on rents as well. I am standing at one of the societies in Rohini. My video journalist Azad is showing you. I am standing outside the recreation center. This is the recreation center for the senior citizen people and for the kids as well. But here they have converted this recreation center into the isolation center. I would just like to go in and just show you that how it's all being done here. It's very interesting visuals which are showing to our viewers. And in fact, here you can see that there are 2 oxygen cylinder first, which is very much required for the COVID patients. This is taken rent around for 7,000 to 8,000 per month. Here, apart from that, here is the bed. You can see that this is the bed, and all things which are required for a patient, all things are lying over here. Here, a water bottle, here bucket, a pair of slippers as well. This is the bed. That there is a blanket. There is a blanket on it, as well as here you can see there are distance between the beds are also there. If you see, there is proper distance. Apart from that, this is the whole arrangement of the medicines. These are the medicines. That also equipments are there as well in the medicines. If you see, there are oximeter here kept over here. This is the streamer. This is nebulizer. These are the medicines that are required, and also the other materials which is related to the mask, PPE kits. All these things are kept over here so that if any emergency takes place in their society, in this society, then definitely they will bring the patient here first, and if any more emergency required, then they will take to the hospital. Yes, definitely we know many patients died between the hospital while shuffling one hospital to other. So this is one of the arrangement. In fact, Sachin, who is the president of the society, is a young president. He mooted this plan. Boss, can you just brief us immediately that how it came to your mind and what is the purpose of this?
As we all know that medical system is totally collapsed in city, and there is no reason to blame any government. Yes. At least we have to support them now. Yes. So when the first patient come in our society, I prepared myself, and from that day I discussed with the doctors, engineers, retired IAS in my society, and with the help of SDM, local MLA, local councillor, we just did it in 3 days. Day and night we worked, we do it everything, whatever we want. And this is the message for other RWAs also, yes.
Okay. Sir, from where did you get the healthcare workers? That is very important. And who will look after them?
Doctors residing in our society, they are helping us a lot, and they have assured us that anytime we require the doctor, they will come and check the patient and do the needful which is required at that moment.
And about the oxygen cylinders, from where did you get it?
We got it from the market, and we have got another pair of cylinders also lying in our office.
Okay.
So in case of any need, we'll give the cylinders to the patients in their homes. Otherwise, if they are shifted here, we'll provide them the cylinders.
Okay. So this is the arrangement, Afrida, and there are some persons who are also at the home quarantine in various societies in the national capital. So definitely all societies, it is the responsibility of the societies. In fact, they are now coming up and they are just believing that it is their responsibility. And yes, definitely they are showing very good, very good gesture by creating this kind of isolation centers. And we hope that other society will do the same. Back to you.
Right, because this again definitely reduces the burden on the health infrastructure, which is of course overburdened already in the major cities. Stay with us, Alok. Let's get all the updates from Bengaluru as well. Now, a similar situation there where the civic body in the city of Bengaluru is now turning towards the residential welfare societies to help them check violations in quarantine and also to monitor patients who are kept under isolation. So with interstate movement picking up in Karnataka, which the number of cases now has hit beyond 7,000 mark, the civic body of Bengaluru has now decided to use resident welfare associations as part of the entire system of monitoring patients who are under quarantine in particular. Now, apart from reporting on violations of home quarantine and not wearing masks, the resident welfare associations will also execute additional responsibilities such as coordinating with suppliers for essentials for those who are in quarantine. So my colleague Shrija is joining us, in fact, to get us all the details. But right now, the important thing is that in all these major cities, at least in Delhi and Bengaluru, we have specific inputs how the RWAs are stepping up. They are now contributing not just in creating these isolation wards, but also in getting the necessary supplies. Remember, not everybody needs hospitalization, but then some might need oxygen supply. The societies are trying to be now self-sufficient in getting the supplies and making people, in fact, stay safe within their home environment, inside the society, with all the necessary healthcare facilities. So if that can be done, it will obviously reduce a lot of burden on the hospitals, which is already overstressed. So in Bengaluru, the resident welfare societies have become the new watchdogs per se, which the civic body has decided will now be roped in formally and made part of the system in order to ensure that home quarantine is monitored. Let me go across to Shrija, who is joining us now live. Shrija, tell us, how is this working out? On paper, it sounds great, this coordination between the civic body and the RWA, but on ground, what are the real challenges for the societies?
Well, Frida, in fact, unlike Bombay or Delhi for that matter, we talk about societies, but here coming to Bengaluru, it is more of resident welfare associations. So we understand that with the rise and spike, the cases here in the city, we see that the total positives have crossed at least 700. And we understand that it was the civic body's decision to involve the resident welfare association to rope them and also give them specific jobs. Yes, of course, they are the watchdogs. They are also the informants. Remember, they are supposed to inform the BBMP or the nearby police station the kind of violations that they witness. But let me go across to a couple of residents here who are joining us this morning from Indiranagar ward, which is the Indiranagar Resident Welfare Association, a very popular one here in the city of Bengaluru. Let's also understand what are the kind of activities that they take up. Well, thank you, Ashok, for joining us firstly. Can you tell us what really are your roles as far as the Resident Welfare Association being the watchdog?
Yeah, so our role has to do with three things. One is as an information conduit between the authorities and the residents, and both ways, not just one way. The second thing that we do is to help residents who are, who are vulnerable. One of my colleagues will take you through that in more detail. And the third thing, as you said, is to report violations to the authorities and then hope that the authorities take action. Right. And that is something we've been doing for the last 80 days.
Correct.
And while the BBMP is doing a wonderful job in ensuring an overall, shall we say, ensuring that COVID doesn't spread too wide, they are powerless if the citizens of Bangalore refuse to abide by the laws.
Right. Well, thank you, Ashok, for that. Coming to you, Sumi, can you also tell us about, since he did mention about being the watchdog and the informants, we understand another crucial role for the residents over here is to ensure that people who are in home quarantine. What is the kind of role that you'll do here?
See, we have an amazing set of volunteers who are still working and were very active during lockdown 1 and 2. So in our WhatsApp group, they would they would ask residents what they want, when they want it. And it was a systematic process, like thrice a week. The list would go to them and they would go pick up medicines for the senior citizens, pick up their groceries, vegetables, whatever was required. So to that extent, the number of people stepping out would be less. So that was a huge help. Right. Another thing, because we are not a gated community, the biggest difficulty we faced and we are facing is we can't force people. You got to wear a mask, you should not be walking out.
Basically just making complaints to the police. That's the
And we also very, very much in touch with BBMP. So we would inform the BBMP officials, and we would request them to come, especially during morning and evening hours when they would walk, so they could find them. We are not authorized to levy a fine.
Correct. Well, in fact, we have residents joining us telling there are various, responsibilities that are given to these people, from reporting violations of, not wearing masks, no social distancing. They also ensure, in fact, such as essentials, even reach the people who are in home quarantine. They do not let anybody within their apartment who are coming from outside who want to deliver groceries or even, for that matter, food as well. Back to you.
Right, RWAs are the new watchdogs. Thanks Alok and Shrija for joining us with your respective inputs. We'll take a short break here. News and updates continue when we return. Stay with us.